Hey everyone, you're watching a sample that's coming from our Home Health Marketing Bootcamp. That's right, over 7 hours of amazing content that's going to be able to help you guys learn what steps you need to take in order to become that preferred provider. So just want to let you guys know, please make sure you stop by 10xpatientreferrals.com and sign up for this bootcamp. It is only available for a limited time at this moment. So right there alone, we're solving a solution. Number one, we stand out again. Number two, imagine this. If you can reduce your readmission rates to the hospitals, that's more money for your company, right? It's called customer or client or patient retention. Another thing we tell these discharge planners is on the weekends, on a Friday, right? The patient's gonna get a call from us. We sometimes do Friday or Saturday. So I suggest Friday, but some agencies that we work with that use our services, they actually have them called on a Saturday, but we do it on a Friday. So what happens is on a Friday, they'll receive a call from us saying, hey, Friday, the weekend's coming up and we just want to be able to let you know that our team is here for you. I was hoping to find out if there's anything that we can do for you. If so, please give us a call at this number. So imagine we're communicating with the patient. We're communicating with the family. This right here makes us stand out. That's why it's such an important thing you guys have. Now, do you guys offer a medication reminder program? Guaranteed 9 o'clock in the morning, 5 o'clock in the afternoon? So that's how we take advantage of our call center services. Now, if you want something like that type of a service, we can definitely help you guys out with that. It's only $10 a month per patient. $10 a month, that does not cost a lot. Unless you just want to hire somebody to do the calls for you. But you're not going to be able to call 100 people during 9 o'clock to remind them to take the medications every day, even in the Saturdays when your company's closed. We do this, if it's a February, we do it all 28 days. We do every day on the month. Every month of the year, 365 days a year, we will call the patient as long as they're under your care. And you let us know to keep on calling. So right there alone, what I just shared with you, what my agencies do to make themselves stand out, what agencies that we market for, what agencies that we help with their marketing team, what we're doing to make ourselves stand out. If you even do half of the things that we're doing as an agency for your agency, imagine what's going to happen for you. Imagine what that's going to do for you. And then you work on your presentation skills. You really, really dive deep into their presentation. Imagine what you guys can do. Now, just to let you guys know, we're giving you guys training, additional free training for cold calling. We're also going to give you guys a training for cold walk-ins. So other than this boot camp that you're having that's over 6 hours long of so much of information, you're also getting additional training to learn for you guys. Now that right there is such an amazing thing. So make sure you guys keep on watching the video. So now this is the part that we're going to move on to the presentation section. What we just did here is to how to make yourself stand out, how to make you different. I'm sharing with you what makes my agencies different. And I guarantee you if I walk into a facility, into front of a doctor, and I work against another agency, my services will stand out because I'm solving problems and solutions. Now before we move on, to the next step after presentations, right? Let's go ahead and ask you guys about those 2 questions for qualification. Remember those 2 questions to find out what you need to know to present to a place? What are those 2 questions? Do you remember? You can pause this video and say it right now. Don't rewind. Don't look at what you wrote. Say it. You should know it by now. More likely you forgot. Because why? We're not practice drilling, rehearsing right now. We haven't done it multiple times. That's what we do here. That's why we want you to always keep on watching our training because that's what's going to be important for you guys. Right? So those 2 questions are, what would be the 3 things that made you choose to work with other agencies in the past? Thank you. Other than the fact, what are the 3 things that if those agencies can improve on to provide better care for your patients and take care of you, what would that be? Once again, 3 positive, 3 negative is the goal. Right there alone, between those 6 things, you can create a beautiful presentation and base your presentation about what is unique about the person you're talking to that you're trying to get referrals from. All right, let's move on to the next section. Remember, we just finished the presentation section. We're moving on to the closing section. All right, guys, we are now in the closing phase, right, of the whole sales process. Now, within the whole sales process, the closing phase is seriously the one part that always gets missed. They always get missed. When we're doing and when we're working, when we're trying to go through the whole sales process, people don't even know that you need to close. Now, in business, in sales, we have what they call the ABCs, meaning always be closing. This came from the Death of the Salesman book, right? And the movie. And it is the truth. When we are in the whole presentation phase, we must be able to make sure we incorporate some of the closing techniques within there. Remember, in the presentation phase, I was talking about the referral close. Like before you get started with the whole training or the whole presentation, you would ask the DM or the decision maker, and you're gonna say, hey, before we even get started, is there any other person that we should have here at this very moment to be able to make sure that they pay attention and they see the value that we can provide you guys? Or I would say something like, hey doctor, other than yourself, who else do you think would enjoy our services? I was hoping maybe you can, refer me a few people that may enjoy using our products in our company for your patients. And they may give you what? Somebody that they know. So all of a sudden you go to that person and say, Dr. Kim told me to come see you because you might value our position, our company, our products, our services, right? And so, what's wrong with that? There's a 50% chance the doctor refers you to someone, but when you get referred to a person, you go to them, there's a 50% chance that they will start using your services.
Brought to you by our partners at HomecareAnsweringService.com and MedicationReminderProgram.com. So MedicationReminder.com, what they do is they can actually call your patients twice a day to remind them to take their medications. This lessens the chance of them being readmitted to the hospital. At the very same time, it provides value. It lets you show your referral sources that you are different, that you want to provide more services for your patients. It works amazingly for home care, especially with home health agencies. So look into this. It's a great thing for you to add for your company. They have 3 different plans, but later on we're going to share with you guys a way to be able to save even more. The next one, HomecareAnsweringService.com. Listen, at nighttime when you get a call from a patient or maybe even potential referral source on the weekends, sometimes you're not able to answer the call right away. At the very same time as you can save money, instead of hiring somebody to do your call answering, you can have HomecareAnsweringService.com handle this for you guys. At a low basic plan of $39 a month, they will handle your calls, especially in the weekends, especially at nighttime. You may have a manager on duty who's in charge of that phone, but at the very same time at nighttime, they may not be able to answer the phones for you. So sometimes when a patient calls at night, a family member, if you miss that call, they may end up in the hospital or you may lose that potential referral. Now, don't forget, we have our live marketing bootcamp events happening all over the United States, but we have now our online marketing bootcamp available, so make sure you take advantage of that. Go to 10xpatientreferrals.com and check them out. So these are some of the cities that we're holding a lot of our events. We rescheduled them because of the whole COVID scare. Please make sure that you pay attention. The dates may change at this very moment, but please check with us. Now, here is how you can save some time. So at 10xpatientreferrals.com, we have an online learning platform, teaches you everything about marketing. Okay, so we have 3 different packages. As you guys can see, if you guys choose the gold plan or the platinum plan, you're going to be able to get some free service from Home Care Answering Service as well as Medication Reminder Program. But if you just choose the silver plan, it's still great. You're still going to get 25% off the Medication Reminder Program or 25% off on the answering service. So please, 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 please let us know how we can actually help you. This is Michael with Home Health Success Academy. Always understand, marketing is easy when you know what you're doing.